provide privacy and wash my hands. Hi Ryan, I'm Molly. I'm your nurse today.
Hello.
I'm going to be doing a head to toe exam on you.
Oh, perfect.
Okay, I'm going to start by asking you to tell me what your name and date of birth is.
Oh, my name is Ryan Mead. I was born March 5th, 2000.
Okay, that looks right. Thank you. And can you tell me why you're here?
For my head to toe assessment.
Can you tell me where you are?
Mead Hospital.
And can you tell me what month it is?
Is still April.
Perfect. Okay. I'm going to be doing a head to toe assessment, so that's just going to involve looking at you from head to toe. I'm going to be looking at your hair, your skin, your eyes, mouth. I'm going to be listening to your lung sounds and your heart sounds, and I'll be having to touch you. Is that okay?
That's okay with me.
All right. Do you have any cultural preferences?
No, I do not.
Okay. All right. I'm going to get a quick set of vitals on you. So I'm going to get your blood pressure, and then I'm going to get your temperature orally, and then I'm also going to be looking at getting your heart rate and your respiratory rate. Okay. Next, I'm going to be getting your pulse oximeter, and then I'm also going to be asking you, do you have any pain?
I do not today.
Not today? Okay, so I'm going to begin our assessment, okay? So first I'm going to look at your head.
Okay.
Is there any sensitive spots I should be aware of?
Nope, nothing.
Okay, your hair looks clean. Our patient is very well groomed. And no sore spots that I can see. Looks good, Ryan.
Thank you.
Next I'm going to go get my pen light, and we're going to be looking at your eyes, okay?
Okie dokie.
All right, so I'm checking to see what size your pupils are, and then if they're equal and round, and they are equal and round. Next I'm going to see if they accommodate to light. So I'm going to be shining the light in your eye twice on each side. Oh yeah, they react to light. They went down from a 6 to a 5. Right, and now I'm going to check for accommodation. So I just want you to stare at the pen, and then I want you to look at the wall behind me. All right, so your pupils dilated, so that's good. Your pupils are accommodating too. So next, what I'm going to check for is your eye movement. So keep your head still, and then just follow my pen light. Everything looks good, Ryan. Next,
Great.
I'm checking for your peripheral vision.
Okay.
So just tell me when you see the pen light.
Right there. Boom. Got it.
Awesome. All right, Ryan. Next, what I'm going to be doing is I'm going to be checking for your temporal pulses, okay?
Okie dokie.
So I'm going to check right here. I'm checking for 30 seconds for symmetry, quality, and strength. Then what I'm going to be doing is I'm going to be moving down to your carotid artery. I'm just going to check one side at a time for symmetry, quality, and strength. Perfect. Then what I'm going to be doing is I'm going to go down and check your brachial artery, checking for 30 seconds for symmetry, quality, and strength. And then I'm moving down to get your pulse at your radial pulse. I'm getting this for 30 seconds, checking for symmetry, quality, and strength. So everything looks good, Ryan. I'm just going to check your skin too. Feels nice and dry and warm. You have an open spot on your hand. And now I want you to squeeze my hands. And then I want you to push against my hands like this. And then flip them over, push again. Good. Very strong. Next, I'm going to check your fingertips for capillary refill. So I'm going to be squeezing your fingers for 5 seconds, one at a time. I'll start with your left hand. All right, that looked good. The blood flow returned within 3 seconds, so I'll do this right side now. And that looked good too. Okay, can I ask you to close your eyes?
Sure.
All right, now tell me what you feel.
I'm brushing down on my right arm.
Perfect. Any pain, tingling, or numbness?
No.
All right, now tell me what you feel.
I'm brushing up on my left arm.
Any pain, tingling, or numbness?
No.
All right, perfect, Ryan. Next, what I'm going to be doing is I'm going to be listening to your heart and lung sounds. If you could take your shirt off, very talented.
Thank you.
Alright, first I'm going to be listening to your heart sound. So I'm going to start on your right side, go down to the second intercostal space, right next to the sternal border. And what I'm listening here for is your aortic valve. And the S1 is going to be softer and the S2 is going to be louder. And then I'm going to move over to your left side in the second intercostal space. And here I'm listening for the S1 as softer and the S2 as louder. And then I move down, still close to that sternum, to the fifth intercostal space. And here the S1 is louder and the S2 is softer, and this is the tricuspid valve that I'm listening to. And then I'm moving over here to the midclavicular line, staying in the fifth intercostal space, listening for the mitral valve. And everything sounds good, Ryan. All right, now I'm going to continue with listening to your lung sounds, okay?
Okay.
So I'm going to listen to your lung sounds starting up here, and then I would have you inhale and exhale every time I place the stethoscope. So up here, I'm listening to vesicular sounds. I would be able to hear bronchial sounds and tracheal sounds right by your trachea. As I move down, I continue to hear bronchial vesicular sounds. So bronchial vesicular sounds are a blowing sound, and they're a moderate pitch. The bronchial sounds are high pitch and very loud. The vesicular sounds are soft and they are low pitched. And then I'm going on the side here too, under your armpit on each side. Listen to the side. Okay, Ryan, everything sounds normal. And can I ask you to lean forward so I can listen to your back lungs, the lung sounds from your back? Okay. Now what I'm going to do is start up here above the clavicle again. And I'm just hearing vesicular sounds up here. As I move down the back, I'm going to not put my stethoscope over the scapula so that I can hear the lung sounds. So now I'm hearing bronchiovesicular sounds. And I'm moving down the spine. I guess I could show you. Ryan, everything sounds good, so you can put your shirt back on. I just want to ask you a couple questions about your bowel movements. When was the last time that you had one?
About 4 hours ago.
Okay, and how often do you normally have bowel movements?
Usually once a day.
Okay, do you have any concerns about your bowel movements?
Nope.
Do you have any concerns about your urination?
No.
Any pain or burning or urgency?
No.
Okay. Do you have any concerns about your reproductive health?
Not at this time, no.
Okay, so next what I'm going to do is continue my assessment by asking you to lift your shirt up. I'm just going to begin by inspecting your abdomen, just looking for any masses or bruising or lacerations. And you look just fine, Ryan. Okay, so next what I'm going to do is I'm going to oscillate your abdomen sounds. So what I'm going to do first is I'm going to listen in the lower right quadrant, and then the upper right quadrant, then the upper left quadrant, and then the lower left quadrant. So what I'm just listening for is any absence of sounds or any irregular gurgling, which I did not find. All right, and then you can lift, I'm gonna next palpate your abdomen, so I'm just gonna lightly palpate your abdomen, just feeling for any masses. Let me know if anything is painful. Okay, Ryan. I didn't feel anything abnormal. You can put your shirt back down. I'm going to continue our assessment where I'd be feeling your femoral pulse
Okay.
right there. So I'd be checking for quality, symmetry, and strength. And then I'm going to continue by checking your popliteal pulses right behind your knee, checking for quality and symmetry and strength for 30 seconds. And then as I go down, I'm going to be looking at your skin, which is nice and warm and dry. And I'm next going to be taking your posterior tibial pulses, which is right here by the ankles. I'm going to be checking for quality, symmetry, and strength. And then I'm going to be taking your pedal pulses right on top of your feet here, checking for quality, symmetry, and strength for 30 seconds. All right, Ryan. Next, what I want you to do is I want you to pull against my hands. Now I want you to push against my hands. Good. And then I'm going to be looking at your capillary refill like we did on your hands, again on your toes. So I'm going to start with your left foot here. So the refill was a little slower on this side. And then I'm going to be going again on your right side here. Good. So that looked good. Now I'm going to have you close your eyes. And I want you to tell me what you feel, okay?
Okay. Brushing up on my left shin.
Perfect. Any pain, tingling, or numbness?
No.
Okay. Now tell me what you feel.
Brushing down on my right.
Any pain, tingling, or numbness?
No.
All right. So I also am looking at your skin while assessing your legs, and I do see a little bit of a rash and a blister over here, and some redness on the back of your heel on this foot. Also would be looking at the bottom of your feet, at your skin too. Everything looks good except for what I pointed out, Ryan. So now I'll just ask that you stand up for the last portion of our head to toe. And I want you to stand with your arms up like this with your eyes closed for 30 seconds. I'm just looking for your balance and to see if your arms are drooping, which it looks good, Ryan. So 30 seconds have passed, you look great. Next, I want you to play patty cake with your hands like this. I'm just assessing for coordination, and look at that. Good job. Next, I'm going to have you just walk to the railing and back. I'm just looking at your gait to see if there's any limping or trouble walking. Which, you look good, Ryan.
Yeah, I know.
All right.
Can I sit
You
down?
can sit down. Well, thank you, Ryan.
Thank you, Molly.
All right. I will let the doctor know that you are ready for him.
Perfect.
Do you have any questions for me?
I do not.
Okay.
Thank you so much.
Thank you, Ryan. Have a good